Do you struggle with getting depth or feeling your quads in the squat? I'm Dr. Joel, a professor of kinesiology and a strength and conditioning coach, and I've helped hundreds of athletes achieve a deeper, better squat that gets them more growth and more strength, as well as more resiliency. There's one common fault that you'll see in both the athletes in this video that we can make some subtle tweaks to that improve their squat, and it can improve yours. All right, so looking at the first squat, it started out well above parallel, and there was a few things that I noticed right off the bat. Her knee was not able to travel very far past the toe. This required her to be able to stay balanced, to stay above parallel and collapse forward. One of the things we did to solve this was we artificially elevated the heels with about a 1/2 inch, 5-pound plates. Heels on the platforms allowed her knees to go much farther past her toes, and thus her torso was able to stay very upright. When you squat in this way, you get a lot more knee flexion, a lot more tension through the quads, and a lot more overall gains, strength, and long-term resiliency in the squat. So this simple trick to artificially give her a little bit more ankle mobility increased her squat, where it started out 4 to 6 inches above parallel. It ended 4 to 6 inches below parallel, which is orders of magnitude different in terms of the gains and resiliency that you're going to get. So for squatter number 2, it appeared as if we had some ankle mobility issues, but when we actually did an ankle mobility test, her ankle mobility was just fine. It turns out she had just been cued to always sit back in the squat. So we started by cueing her to allow the knees to travel past the toes and stay upright. And this fixed a lot of her problems. But she has some anthropometry that would make her very successful at low bar squatting, but would hurt her in high bar squatting. So on top of having good ankle mobility, what we needed to do for her was also elevate the heels, giving her even more ankle mobility. This allowed the knees to travel farther past the toes to deal with her long femurs and allow her torso to stay nice and upright. So even though her ankle mobility was good, her anthropometry wasn't that attuned for high bar squatting. So we artificially, with plates again, gave her more ankle range of motion, and thus allow the knees to travel farther forward, getting more flexion at the knee joint, more strength, more hypertrophy, and more resiliency when you're squatting like that. And you'll notice that we got her from a really bent over parallel squat to a very upright parallel squat. And both of these changes for both these athletes are going to help with overall hypertrophy, strength, and resiliency at the knee joint. And hopefully you can take these tips and improve your squat so that you can be the most jacked person at your gym. I've been Dr. Joel, and I'm off to go eat some cereal.